So, hello everyone. My name is Stephanie Oden. As she said, I'm the executive director of Valley Silvertown Assisted Living in California. We are an assisted living and memory care community. I want to start off with my why this is so important to me. My grandmother was diagnosed with Alzheimer's and she passed away in '06. And I take care of residents that have Alzheimer's and other dementias. I am also a facilitator for support groups, and I also do Alzheimer's discussions and talks for different groups such as this. So that is part of my why I'm here. Dr. Nikos?
Hello, nice to meet you. It's a privilege for me to be here among you. I'm a doctor of naturopathy with a great research based on the human biofield. And I would like to speak about prevention before having any physical symptoms. So I am also the director of Humanopathy Academy, an academy that is training doctors on a holistic system, how they can diagnose what's hiding beneath the disease. And I will be delighted to talk to you about this also.
Thank you.
Hello, everyone. Thank you for having me here. My name is Reza Abduli. Is it turned off?
I don't know.
Hello? Oh, there we go. Right, sorry. So my name is Reza Abduli. I'm here from the Pulse GPM. I'm co-founder and the CEO. What we do is bring in the ChatGPT to healthcare to help and optimize the hospital operation and also improving the patient care. I'm glad to be here to be discussion about Alzheimer. I believe many of us have someone in the family as affecting this disease. We are up hopefully to have some discussion to gain some information from this panel. Thank you.
And you again, sir.
Yes, me again. I'm still here. So, my name is Robert Chistel. I'm Professor Emeritus of Pathology, Environmental Health Science, and Radiation Oncology. And previously at Harvard. I have 16 patents and 6 companies in healthcare. And it's patented in 157 countries in the world, all countries that allow patents. I think the title should be a previously uncurable disease, because you guys didn't know about me. And not that I can cure Alzheimer's, but I can stop the progression of Alzheimer's. Should I talk about this now?
Yes. Sure.
Okay. Yes,
go
ahead.
Why not?
Sure. That's my 16th patent. So what the chemical does, I cannot revive dead cells.
Dr. Robert, can you move the microphone closer?
Yes. So that's my 16th patent. So what the chemical does, I cannot revive dead cells, but it stops the proliferation of dying cells. It stops the cells from dying. It's very neurogenic, my chemical, actually. It reconnects nerve cells after surgery. It's very neurogenic. That's why I can cure also mental diseases, and it actually makes you see better because your retina and your optic nerves are nerve cells. Anyway, so it stops the proliferation it stops the degradation of cells, of neurons, and then 50% of all Alzheimer's patients also have depression. I can also cure depression. It gets rid of depression within a week, the fastest ever. And then, because the progression is stopped, at some point people feel better almost immediately or within a week, and then the brain is very malleable. So other brain regions can take over, and it's a slow relearning process, and then people remember things better. So it's not a cure, but it's stoppage of, you stop the progression, and then people remember things better. Similar to what I can do for Parkinson's. People start then moving better. Yeah.
Thank you, Dr. Robert. I wanted to say, in my experience with dementia and memory care, usually by the time someone's diagnosed, it's too late for intervention. It's too late for treatment to slow the process of the disease down. So I want to ask you, Dr. Nikos, What challenges have you seen with early detection of Alzheimer's or any dementia?
Well, first of all, I would like to think about what's hiding beneath Alzheimer's disease or dementia. And most of the times, toxicity is the main factor. Toxicity that can come through heavy metals, that can come through radiation, or even viral infections. And the other thing that is involved me with any neurodegenerative disease can be also the emotional factor. I mean, if we can study the personalities of the people that are more easily to get Alzheimer's or dementia, you might see that there is a pattern. So in our practice and in our training, we're trying to guide professionals how they can address the root cause behind any disease. My latest experience is with my mother. After COVID, she had dementia, and this came very intensively and very fast. So, trying to support her, I tried prescribing her a combination of different homeopathic remedies, and she had a great improvement because the archetypes and the frequencies of different remedies can charge and can boost the patient's energy. And you can see that my mother now, she can speak, she can walk. And the only thing we did is a combination of different homeopathic remedies. But these remedies are also connected with her personality type. So we can see there is a connection between your personality, your height, your character, your mindset, and the development of the disease. And that's something we want to train people, doctors or therapists, to be aware so that they can guide it, what's behind the disease. And speaking about prevention, prevention means that if you have these protocols, if you have this research showing what type of personalities are more possible to develop dementia, that's where prevention comes. So we can have a research, and our Humanopathy Academy will be delighted to host this research so that people can study in different groups, and we can see which homeopathic personalities are connected with dementia and Alzheimer's, and then we can have much better information.
Riza, I send you the same question.
Absolutely, that's a good discussion. So, as we all know, 60% of the diagnostic people to the Alzheimer has been the latest stages of the Alzheimer that has been detected. So, unfortunately, many of the PET scans, lumbar reductions, and everything, treatment comes very last. And one of the major problems is we need to go by the genetic types, go to the MRI scans to understand the patient much earlier stages before it's too late, before it's the nervous damages already happened and everything can make difficult. So, by mean that, one of the major problems, that's one of the major problems we do have. So one of the solutions is common right now. It's using that's the perspective I do have. I just want to share with the members here. So with using the AI, so they're gonna understand the MRI scan and everything. They're gonna do the speech learning from the patients. They're gonna detect the movement of the patient. So if there is any new movement or changes in the normal patient acting, they're gonna understand it. They're gonna do the alarming for the prediction of the Alzheimer's. So that's the key we need, I believe, to add these technologies to our diagnostics process to make this life of the patient more expanding and more easily, and also reducing the cost for the treatment in the later stages.
I have a question. How can we go about diagnosing the correct dementia sooner? We have Alzheimer's dementia, we have vascular dementia, Lewy body, Parkinson, there's so many. What do we need to do to diagnose the correct dementia sooner so they get the right treatment?
So I believe one of the main reason is the family has already been affected. So, for example, like a cancer. So we knew if you have a family member affected with cancer or Alzheimer, you have the potential to get Alzheimer. So if starting the treatment and starting doing the scan, regular scan, MRI scan, or PET scan, it's going to be crucial for you. It's going to help you to preventing, or you're not going to even have it, but just in case, to just have understanding about the future, what happened to you, to better understand situation. Start earlier, not just postpone it to the later, acting like, no, everything good, because we don't know all of a sudden it's happened and it's too late when it's happening. Because as I mentioned, 60% of the diagnosis are the very last stages, which the treatment is almost limited. We're not able to do the treatment. So regular, if you have a family members has this diagnosis, so please keep do the PET scans, MRI scans, and treatment, and share that with your doctor, so they're going to give you the related test, so they can understanding and track any changes in your behavioral, so they can change it, they can understanding and let you know if there's going to be something new happening, and they're going to share with you.
Dr. Robert, would you like to add to that?
Well, the detection methods become more
Closer,
and more
closer.
The detection methods become more and more sensitive, and I have beginning stage Alzheimer patients. So there are really a whole spectrum of them, and I also have to emphasize that, at least for me, nothing is too late, right? So even if with progressed Alzheimer's, they still feel better, they live longer, and they remember things a little better. So I'm even in hospices now, okay? So, and for hospices, it's perfect. They can still talk to their grandkids, and they can still participate. They are hungry, and at some point something gives in. Either the brain or the heart, but they don't starve in pain like nowadays, but they quietly and happily pass away.
Dr. Nikos?
Well, that's a very interesting information, but the thing is, this is not prevention. This is improvement of the symptoms and improving the life of a patient. But when we research a disease from the perspective of a biofield, of the energy field around the body, which in fact is part of our existence, we can see that the disease first manifests on that energy field. So that energy field is a field that has awareness, it has a field that has subconscious information, and when we are saying that in a family that has some cases of Alzheimer's, of another, or dementia, you are most probably to have to deliver that kind of disease, you have to consider that this biofield in the family will have a connection. It can be a epigenetic connection, DNA connection, but it doesn't have to be only the genes. It can be in the energy. So for me, being able to detect what happens in your biofield and being able to understand if there is some kind of a biofield interaction and willing to disconnect from the body, then this is a thing that we have, and it probably can be connected to depression or a stressful life or different, or a mindset developed by the community or fear. Then we can go beyond and try to release this energy from the biofield in the body. And so we have much more possibilities not to develop diseases like that.
So, Riza, I have, what would you say to your colleagues or peers, or if you were in a room full of medical professionals and they wanted to learn how to, or not learn, but learn, well, be taught how to, diagnose sooner, or what resources are available to them so they can diagnose their patients sooner? What would you tell your colleagues or peers or medical professionals?
So that's a really good question. So right now it's happening. Right now we're using the AI. So what the AI doing is, there are the models. they can understand the MRI of patients and so similar patient for many, many patients and the back histories many times. So the model is gonna understand the tract of any changes of the behavior of the patient. So the models we are using and implementing into the healthcare is, so since they have a variety of the data sets and variety of the different tests, from the blood test to the PET scans to the MRI scans, they can understanding and give the related of the prediction for the patient. There are some hospitals currently using AR models and give them 90% accuracy of the prediction of the Alzheimer for the patient. So these are the happening right now, and so many of the healthcare services are providing this type of technology, machine learnings, and AI models to predicting of any sign of the Alzheimer for the patient. So these models, still, I just want to mention that still there is so many negative side on that, because we need to make sure the privacy, we need to make sure some of the tools of the taking the test is need to be FDA approved. So these are the other concerns. We are still concerning for the AI models to predicting the Alzheimer, but so many cases has been happening already. As I mentioned, 90% accuracy of the predictions. These are the technologies we need to implement them to make our life much easier. And one of the I just want to mention, the AI is not replacing any doctor or medicine services. They're just empowering them, just to help them understand the situation of the patient and how we can improve the health of the patients.
Yes, we definitely still need our physicians. Dr. Robert, have you had any experience with training other physicians about early detection or, different, early detection? Have you done training? Pick up your mic.
So actually, the methods become more and more sensitive. You can have all kinds of tests for early Alzheimer's, whether those are language tests or memory tests, and they can be guided by AI or whatever. And there are self-tests, or you can do that in the clinic, to diagnose lapses in memory and repeated lapses in memory. And everybody actually probably knows themselves if you lose your keys or somewhere. And if this happens repeatedly, then might be at some point you might need some help. Not if you're young, but once you're up. So Alzheimer actually highly correlates with age. So the older you are, the more likely you are to develop Alzheimer. But yes, methods become more and more sensitive, and they get younger and early and earlier stage Alzheimer patients.
Dr. Nikos, in your mind, what would be some of the outcomes for patients and families with earlier detection?
Well, if we have an early detection, they wouldn't suffer for the disease. But the thing is that how do we detect? We detected the disease when it starts having physical symptoms, or we can detect a pattern before we have physical symptoms and be discovered. For me, we have to go beyond that and try to understand what's happening in the body, and especially we can connect a lot of brain diseases with the gut. So the gut, a leaky gut, is directly connected with toxification of the body and the brains, and then the leaky gut is also connected with depression, sadness. So if we can find a pattern before the Alzheimer's disease or dementia will develop, then we have real prevention. For me, we have to work on that, on nutrition, the leaky gut, and then the research of the emotional pattern. For example, one of the remedies I prescribe for dementia and Alzheimer's is opium. And opium is a remedy that indicates that somebody is willing to go away from the problems of everyday life. So opium as a homeopathic remedies is treating symptoms that opium can create. So you can see that there is a pattern. When somebody needs something to be detached from a very negative life that is bringing him misery, the brain finds a way to be detached, and we can see diseases like that being developed. We are living in a society that is not so friendly, and also there are a lot of toxins everywhere, radiation, heavy metals, bad nutrition. So we have all the things on the table that can provide such a disease. For me, prevention is take out all of these parameters from our table, and then we will not have the development of the disease.
Dr. Robert, have you prescribed any of the new medications for dementia treatment, like lecanemab?
Actually, I have developed my own medication. I don't prescribe any other medications because nothing else works better than mine. And the unusual thing of my chemical is that, first of all, it's the only substance in the entire world which doesn't have any negative side effects, and therefore I don't even call it a drug or pharmaceutical. And so far, since 3 years we are doing clinical trials. So far, none of the patients in my clinical trial either died or even developed a second disease, because it also prevents all the diseases it treats or cures. And it's not just Alzheimer. I can cure almost any disease in the world with my 16 patents. So if you guys are interested in what I do, I'm happy to connect.
Dr. Robert, you're a very busy man.
Definitely.
I wanted to ask, Riza, do you feel race plays a part in early detection, treatment, outcomes? Would you address that for the panel?
So you mentioned the race?
Race, yes.
Yes, so definitely. Unfortunately, many families, some of the treatment and diagnosis happening for the patients, like you mentioned, the PET scans, they are not easy, cheap, and they are not really easy accessible for many people all around the world. And these are the unfortunately happening and make it harder for people with different races, with different financial situation, make it difficult for them to have the easy access to this type of diagnosis, and also the next level to do the treatment. Unfortunately, that's almost 79% of the people have some sort of situation is not easy access for them to go. I earlier mentioned if you have a family member has this type of disease, you should go ahead and do the pre-diagnosis and everything, but unfortunately it's not happening and it's not easy for everyone to do that. That's the reason, financial situation and also the cultural differences, that makes it different for everyone. But I believe with the new technology, make it more easy accessible to everyone, and because it's already forming and shaping the new healthcare of the treatment, make it easiest and to give the other patient with different races, with different culture, with different financial situation, give them an opportunity to use this type of treatment for early diagnosis of the Alzheimer's. It's happening, but I just cross the fingers. Hopefully in the near futures, we can somehow improvement to make those gaps narrow as we can. So make sure everyone all around the world have the easy access to this type of treatment and diagnosis.
Dr. Nikos, your homeopathic treatments, are those, do you have any races that have issues acquiring this treatment, or is it available to everyone, or is it insurance-based? How do people go about getting the homeopathic treatment of this disease?
Look, we are not only using homeopathic treatments. In our academy, we are training doctors to combine different therapeutic modalities. So we train our doctors in homeopathy, because from homeopathy we can discover the personality of the person, and we train them in Chinese medicine, so that the doctors can know how the organs are connected and which emotions are triggering which areas of the body. Then we train doctors to neuro-linguistic programming so that they know how to communicate with the patient. We train them about nutrition, lifestyle medicine, and all of these are tools for somebody to be able to go deeper. And when we are speaking about different races are usually have different emotional expression. So people that are very passionate can be very happy in the one moment, but they also can be very sad.
Are you talking about me? Oh my goodness.
I don't
We've
know.
only been together for like 20 minutes.
I would love to be together with you for more, but I like people that have passion. But the thing is that when you have passion about the good things, you have passion about the negative things. And so this has a great impact on your gut and on your lungs. So you are most possible to deliver certain diseases. And you can see when people are exposed to different viruses or different bacteria, not everybody reacts the same way. So for me, going through a protocol that can detect the imbalances in your body based on your emotions, your lifestyle, your mindset, your trauma, then you can do real prevention. And of course, you have to detox your body, detox your gut, change the microbiome of your gut, as other speakers said earlier. I think this is the right prevention.
So, Riza, what would you like to see going forward in the detection and treatment of Alzheimer's and other dementias?
So, as I mentioned, making sure it's going to be easy access and accessible for everyone all around the world. I believe that's my passion is, and I'm looking forward to this happening. Because unfortunately, as I mentioned, so many of people, they don't have the easy access to this type of treatment and early diagnosis. So that's a goal and passion I do have. I mentioned that I hope someday soon this gap gonna be gone. No one gonna have the excuses of not having the easy access to this type of scans, treatment, and diagnosis. That's going to be the goal. And one of the other things I just want to mention that we never forget about the family of these type of people. As the last panel, there was talking about the cancer, and the people of the family have also some sort of cancer, but Alzheimer is happening too. If you have any family member has Alzheimer, you know how hard for their family is to take care of that person.
Yes, caregivers suffer greatly.
Definitely, because that person, unfortunately, not knows what exactly he or she is doing, but the family still loves that person. They still want to take care of that person. So we need to some sort of providing support for the family as well. I know the Alzheimer person has affected and has life-changing, unfortunately, happened to he or her, but the family needs some support as well. So we need to provide some sort of treatment or providing some sort of taking care of the family as well for them.
Dr. Robert, what would you like to see going forward?
Oh, I want to connect with everybody who has any disease or is interested in disease. Actually, it makes you happy. You can see better, you're a better driver, your reactions are better. And yeah. And you guys have the best day, best evening ever.
Can I ask a
Dr.
question?
Yes?
Your treatment, maybe I missed that part. How's the treatment?
It's oral.
It's oral?
It's oral. So, and there's lots of unusual things about me. So I do not make money from my patients. I refuse to make money from treating people. I give my medications. That's also why I say it's not. I don't sell my treatment. I treat people, and I only charge what it costs me to produce it, and the shipping costs. And currently it's $7 per day. It's actually $7,000 per kilogram to produce it. And it's the human dose is 1 gram per day, so it's $7 per day, $7 per day. And the minimum FDA, for FDA approval, the minimum time period I can use is 4 months. So it's $840, and then you're set for 4 months. And people stay on it because it doesn't have any negative side effects, and there are additional benefits after the 4 months. And you don't want Alzheimer's to come back after that.
Definitely.
Yep. Yeah.
Just another question from Doctor. Doctor, you mentioned about how depression could cause Alzheimer. I just wonder if you can talk more about this. That's a brand new information. So you mentioned that. So just wonder if you just expand that area about the depression. How could be the reason or one of the reasons of the Alzheimer?
I believe that depression has a direct impact to your lungs and your gut. And the gut microbiome is directly connected with the brains. So from an energy point of view, depression is directly connected with the brains. So I have the joy to have my son in Imperial College studying how boredom and depression is connecting with the brain cells. Hopefully we can present his research shortly. But the thing is that every disease is starting when we have a lack of energy in a certain organ. So, and when you know the connections between the organs, you can understand how are the interactions. On the other hand, I'm very much triggered from Dr. Robert. And our motto in the academy is that knowledge that is not shared, it's knowledge that has no need, because we are going to leave this planet one time or another. So I will please invite you, if you would like, to share your knowledge in our academy, so we can train other doctors. Because what you are producing, you declare that is giving therapy to many different conditions. And I would like to see how it interacts with the body energetically.
We're making connections at Health 2.0. Making connections.
Sure,
That's why we are here.
Actually, you're absolutely right. There's a gut-brain axis, and actually, what people don't even know that 95% of all the serotonin is made in the guts, not in the brain. Okay, and yeah.
Are you going to accept his invitation,
Yes,
Dr. Robert?
absolutely.
Okay,
Absolutely.
good.
Absolutely.
Thank you.
Yes,
Interesting.
yes, absolutely.
So I have a question. There's been more in the news about early onset Alzheimer's and dementia, or younger onset. Have you had any experience with patients that were younger than 50, or and you've been diagnosed with some type of dementia? Have you had any experience with that? That's for you and Dr. Robert. Dr. Nikos first.
Well, I don't have special experience in young people with dementia, but I believe that toxicity is always the first factor. I've seen a lot of people suffering from dementia after COVID-19. So we can see that a viral infection has a great impact in the brains. And unfortunately, young people are very stressed nowadays because it's very hard to make a living in this society. So again, stress become a depression factor, and this can lead young people to develop actually dementia. You can see that they start being more forgetful, more detached. So this is the first stages for me.
Dr. Robert?
Actually, to this, it's not that the virus caused all those problems. Partly, it's a mental problem that just locking everybody up for 2 years causes stress and mental. We stopped interacting with each other properly and stopped the proper social interaction, and thereby depression and all these things increased. And the virus, actually, it's not very toxic to us. The virus, but what it does, it makes our immune system haywire. That's what COVID did. And what killed us, it's not the virus, it's our own immune system. This immune storm is actually our own immune system that killed us. And it's a very unusual virus. It's not that toxic to us, but our own immune system goes completely crazy. And what long COVID is, it's also, it's due to inflammation and autoimmune problems, and that's by our own immune system. The virus is long gone, and our immune system is still disturbed. And yeah, I can cure COVID within 2 days. I can also cure long COVID, and it also prevents COVID, which nothing else can do.
Man, there was a plethora of information up here today. So now I want to see, are there any questions in the room? Does anyone have questions for our panelists in the room? Yes, beautiful.
I would like to connect with all three of you. I just want to make sure that you're going to be here for the next few days.
Yes, I
all gonna
won't
be here?
leave. Yes, I'm here for all 3 days.
Go
yeah.
right ahead.
And I get awards all the time, yeah.
So my mother has been recently diagnosed with early onset dementia. Because of the issues, we've missed all of her doctor's appointments. What is your opinion on healthcare available for people that are on Medicare, Medicaid? And we are having a really hard time getting her back in to see anyone. So what are your thoughts about physicians, nurse practitioners, just availability of providers in this space?
Dr. Nikos, you can answer first.
Well, I don't have any experience in this field. I cannot answer that. I'm from Greece.
Okay.
And things are much easier there. We are much more connected with
We're
everybody.
moving to Greece. We're moving to Greece, guys. We're out of here.
You are
Let's
all
go.
welcome.
Because of political reasons.
Maybe next year all we have can be in Greece.
Dr. Robert, do you have an answer for her question?
Actually, so I cannot do anything about this right now because it's not FDA approved, and you cannot, doctors cannot prescribe it right now. But any if there's no other medications that works as well or addresses certain things, then they can refer the patient to me and then I treat them. So $7 per day is not that much, but and it's about 1.5 years away from FDA approval. After FDA approval, you just pay your co-payment.
Wow.
Yeah.
My question though was about providers. I mean, are you all seeing that there is less, we're having trouble getting her in to see the doctor. He's, and this is a very large facility.
Is it because he's like overscheduled or they're short staffed?
We're seeing this kind of everywhere. And so, she's my main concern.
Have you thought about mobile doctors?
They don't even have virtual space. So tell me more. How can we do, we can't even get a virtual appointment for her.
Where do you live? New Orleans? Yeah, well, I'm from California, and we have a plethora of mobile doctors that will come and do house calls and visits and establish care.
Yeah,
for
video
people.
calls.
What you
Video calls. It's
Do that
done
too,
all
but-
the time. Yeah. You can treat people on the other side of the globe. Yeah.
No, I understand all of that. We're having trouble even getting virtual appointments.
So this is my opinion, when you go back home, look up mobile doctors in the area. And there has to be some, especially after COVID, after the pandemic, look up mobile doctors for seniors and then go from there. Or neurologists, yes. Neurologists, I'm not really sure yet, but start with primary. Start with a primary.
Not all that. I'm talking specifically.
Like specific neurology, then try that. Try that mobile doctor for neurology. And then, that's just my opinion. Okay.
I know that happened, and one of the issue with going with out-of-state doctors and physicians, it's going to be the insurance problem. They mostly not going to cover that. But I saw so many patients, they go out of state, to get the treatment. Unfortunately, I had a friend of mine has early diagnosis of cancer. After 6 months, he got the chance to visit the doctor, but the cancer got bigger and bigger, and whole body was affected with the cancer, and it was too late. Unfortunately, it happened right here in Los Angeles, California happened. And so many cases, the patient going to go out of their pocket. They're going to go other states for the physician to make sure they have the early access to the physician and have their advice on the treatment.
Are there any other questions? Well, I want to thank all of our panel members, Dr. Robert, Riza, and Dr. Nikos, for all of your information all of your enlightening information and your help in your discussion. And I just want to end that, early detection is very important for diagnosis and treatment of Alzheimer's and other dementias. It helps with better patient outcomes for the patient and the families. The families get more time with their loved one with early detection. So I just want to say thank you, everybody.
Thank you.
Isabella.
Thank you for the lovely energy. Thank you.